Hello, Mr. Kumar.
Yeah, hi,
Thank,
hi.
thank you for taking some time out for us to have this chat. I welcome you on this platform. This is just a platform for asking leaders to share about their thoughts about the technologies and their experience in healthcare industry. So it will be great if you can share some of your experiences with us. Maybe we can start with your brief introduction and the professional background, how you got into this facility management.
Yeah, first of all, thank you so much. You consider me for this. I'd like to introduce myself first. So, as you already mentioned, myself, Raj Kumar, and I am this industry since last more than 13 years. Before, when I started my career, actually, I started as a pharma technician. But eventually I got into facility in 2007, and since then I'm same in healthcare. I got into around 2013. I got into healthcare. Since then I'm just enjoying my journey with healthcare. And healthcare, if you ask why healthcare, yes, healthcare is a platform where there is no seasonal business, or there is nothing only you are working. Along with working, we are also doing a service to the patient who are actually in need. So we really feel good and feel pleasured about serve the patients who are actually in a very bad condition. If you say other facility industry like IT, hotels, people come there to enjoy their life, but here we are here just to serve the patient who are in needs. We have to understand their pains, their challenges, even their financial condition, affordability. Everything we have to look into and consider everything when we are in healthcare facility basically. Because we don't have a specific range of people who comes to us. Starting from lawyer, background, even we got VVIP people as well. So there is a mix of all categories of people who are living in the society.
Great, good to know about it. So, what are your top responsibilities being in the facility department in your hospital?
Yeah, here I'm heading 4 departments: F&B, housekeeping, stores, facilities, and event management as well. But on paper, yes, this is only the 4 department on paper I'm having. But if you see practically, being a facility head in healthcare, we have to also take care of the asset management, patient satisfaction, services of the hospitals, even our operational activities. Facility is one department which is related to every department, single department. We have to work along with the nursing, along with the management, along with the housekeeping, security, every single person where we have to get touch with.
True. So it looks like a vital department of the hospital which actually controls many activities in the hospital.
Exactly.
So if we talk about the goals, what are your key goals in the department and the challenges you have faced so far and have been facing being in the department, or maybe in specific areas like F&B, housekeeping, where the expectations are pretty higher and deliverables are limited and very you have to be on your toe every time, particularly in these specific departments. So how do you manage those challenges? What are the challenges you face day-to-day basis?
That's true, absolutely true. There are certain challenges we face regularly. And if you ask about our goal, it's very simple. Every healthcare worker, not only facility, I think every single individual of this hospital, our goal is patient service and patient satisfaction, which is really a top priority for us and top challenges as usual. Why I said top challenge as well, because different facility industries, there people going to enjoy their lifestyle, their with their friends and family, but here they come with pain. So satisfying the people who are already in pain, financial stress, and having some kind of medical need, it's really difficult for to fulfill that. But we always try our best to manage it, because every hospitals are same. If you see the kind of procedure, the kind of medication they give, it's very similar to every hospital. People choose or see the differences in the facilities. what kind of rooms we are available, we have available, what kind of services we are giving to them, what kind of quality food we are giving to them, our linen quality, manpower quality who are serving them, and how careful, how empathetic we are towards them. That's the differences they made actually from different hospital to different hospital. Secondly, we talk about quality. So when I talk about quality, it's also depend on what kind of quality manpower we are having. Specifically in facility, in housekeeping, it's really tough to get qualified manpower. And being in a twin city and one of the major city of India, we get all locality people. So we have to have match of Telugu speaking people, Hindi speaking people, even who can communicate in English as well. So getting such kind of multi-skilled people in housekeeping and serving our patients, it's really tough, and also we enjoy. That's how we succeed. We never deny those requests for patient. If somebody asks, I know only Telugu, I need Telugu speaking people who can be with me, mingle with them. That kind of facility also we provide. That's how we are different from others.
It's so good to see that patient experience is your prime objective here in this hospital. So how do you see technology improving the performance of your department or patient experience? So how do you manage it? How do you see technology helping?
Yes, it's a very good question actually. Personally, I love to introduce more technologies into the department, because when we started our career, nothing was there into facility with the kind of technologies. Everything used to be managed manually. Even our cell tracks, even our billing system, everything is one manual, and we used to depend on the security register and all to do the manual billings. But now, since the new technologies are coming into the market, we are getting habituated to it, like our complaint management system, where patient can directly send their feedback directly to the top management, where nobody can hide anything, and we have to have a review system on that. We can track, what kind of complaints we are getting more in our facilities, or particular floor wise, what kind of requests we are getting more. So we can really analyze those issues area wise. That's how technology helping us, even in the matter of billing of manpower, because normally we deal with this outsourced manpower from providers who just supply the manpower in housekeeping, F&B in those areas, and their billing system is one of the major challenges when we talk about the finance part in facility. So even technology helping us in that by getting onto this biometric attendance system, then digitalized tracking of their movement. There even how many tasks we are assigning them, how many they are completing on time, and how many we are actually not able to complete on time, and what is the cause. Every single tracking is become easier for us now.
Absolutely. I believe managing so many departments all together is such a challenging task. Need to have some technology around it so that we can have a close watch and control over those.
Even in future, sorry to interrupt. Even in future, I guess there are companies are looking after, to get an RFID system into the healthcare, because in healthcare, even the assets and manpower, nobody is fixed into each individual areas. They keep moving. Suppose one patient bed is there, that patient bed moves from one floor to one floor, ICU to IP to OT. They keep moving. So tracking those materials and manpower is really being difficult manually. So I expect if companies like you can come up with some solution where we can track this movement through electronically, manpower movement and asset movement as well. That would be really great in future for healthcare.
Absolutely. That is great. So, any general tips and best practices you would like to share with us and the viewers and other leaders in the industry?
So, for industry, yes, as I suggested, tracking of material and manpower is a major challenge now, what every hospital faces. So come up with some solution where one manager can sit in his chair and can track his entire 300, 400 or 500 people who are there, what they are doing, how best effectively we are utilizing them. More into digitalization on tracking, billing and assets. That one part for you, and for public, yes, being in COVID scenarios, still it's not over. So I suggest still you have to take these precautionary measures. What healthcare people following in the hospitals, we should also follow in our home, because we have kids, we have our parents who are old age. So taking care of them with appropriate measures and precautions is very important. So that's what I can suggest.
That is great. Thank you so much, Mr. Raj Kumar, for sharing your thoughts, ideas, and views over technologies and in this health industry. Thank you so much for giving your time.
Thank you.
All the best. Thank you.
It's a pleasure.